8 dangerous supplements. Kidney patients need to know about. Number 6 will surprise you. Have you ever wondered if those supplements you're taking might be doing more harm than good? Especially if you're dealing with kidney disease? You're not alone. Today, we're diving deep into the world of supplements and kidney disease, revealing 8 surprising supplements you should avoid. Stay tuned, because number 6 might shock you. Kidneys are important for controlling blood pressure, making red blood cells, and keeping your bones strong. But when kidney disease strikes, this amazing filtration system starts to break down. Waste can build up in your body, leading to a host of problems. It's not just about feeling unwell. Untreated kidney disease can lead to life-threatening complications. It often develops slowly, and in the early stages, you might not notice any symptoms. That's why it's sometimes called a silent disease. But as it progresses, you might experience fatigue and weakness, swelling in your feet and ankles, persistent itching, changes in how often you need to urinate, sleeping trouble, poor appetite, and muscle cramps. The causes of kidney disease are varied. Some people are born with kidney problems. Others develop issues due to other health conditions like diabetes or high blood pressure. Sometimes it's a result of injuries or exposure to certain toxins. Left untreated, kidney disease can lead to serious complications like heart disease, bone problems, anemia, nerve damage, decreased immune function, and in severe cases, kidney failure requiring dialysis or transplant. When you have kidney disease, this delicate balance is disrupted. Your kidneys might not be able to remove waste products efficiently, or they might struggle to balance minerals in your blood. This is why some supplements that are generally considered healthy can become problematic for people with kidney issues. Now let's dive into those 8 supplements you should avoid if you have kidney disease. Remember, this list isn't meant to scare you, but to empower you with knowledge to make the best decisions for your health. 1. Herbal supplements. Herbal supplements are often perceived as natural and safe alternatives to conventional medicine. However, for individuals with kidney disease, many herbal supplements can pose significant risks. Let's delve deeper into some of the most problematic herbs. St. John's wort. This popular herb is commonly used to treat mild to moderate depression. However, it can interact with numerous medications often prescribed to kidney disease patients. St. John's wort is known to affect the cytochrome P450 enzyme system in the liver, which is responsible for metabolizing many drugs. This interaction can lead to reduced effectiveness of immunosuppressants used in kidney transplant patients, altered blood levels of certain blood pressure medications, interference with some antidepressants, potentially leading to serotonin syndrome. Additionally, St. John's wort can increase photosensitivity, which can be problematic for kidney disease patients who are already at higher risk for skin issues. Aloe vera. While aloe vera gel is generally safe for topical use, oral aloe vera supplements can be harmful to those with kidney issues. The concerns include electrolyte imbalances. Aloe can have a laxative effect, potentially leading to potassium loss. Dehydration. The laxative effect can also cause dehydration, which is particularly dangerous for kidney patients. Interactions with diabetes medications. Aloe may lower blood sugar, which could be problematic for diabetic kidney disease patients. Moreover, some studies suggest that long-term use of oral aloe vera might actually contribute to kidney injury, although more research is needed in this area. Licorice root. Licorice root has been used traditionally for various ailments, but it can be particularly problematic for kidney patients. Here's why. Affects potassium levels. Licorice contains glycyrrhizin, which can cause the body to excrete more potassium. This can lead to dangerously low potassium levels, hypokalemia, raises blood pressure. The same compound can cause sodium and water retention, leading to increased blood pressure. Interacts with diuretics. Many kidney patients take diuretics, and licorice can interfere with their effectiveness. Even small amounts of licorice, such as those found in some candies, can potentially cause issues for people with advanced kidney disease. Noni juice. Marketed as a cure-all, noni juice is high in potassium, which can be dangerous for those with impaired kidney function. Additional concerns include high sugar content. Many commercial noni juice products contain added sugars, which can be problematic for diabetic kidney disease patients. Liver toxicity. There have been reports of liver damage associated with noni juice consumption. Interference with blood thinners. Noni may increase the risk of bleeding when taken with anticoagulant medications. It's important to note that the effects of herbal supplements can be unpredictable, especially when combined with kidney disease and other medications. 2. Creatine. Creatine is an amino acid derivative that's naturally produced in the body and found in certain foods, particularly meat and fish. It's also one of the most popular sports supplements, known for its ability to increase muscle mass and improve athletic performance. However, for individuals with kidney disease, creatine supplementation can be problematic for several reasons. Increased creatinine levels. Creatine is converted into creatinine in the body, which is typically filtered out by the kidneys. In healthy individuals, creatinine levels are used as a marker of kidney function. For those with kidney disease, creatine supplementation can artificially elevate creatinine levels. This can make it difficult for doctors to accurately assess kidney function. It may lead to unnecessary concern or misinterpretation of lab results. Extra workload on the kidneys. When you have kidney disease, your kidneys are already struggling to perform their normal functions. Adding creatine to the mix increases the amount of waste products the kidneys need to filter. It can potentially speed up the progression of kidney disease and may lead to further kidney damage, especially if dehydration occurs. Dehydration risk. Creatine supplementation often leads to water retention in muscles. This can increase the risk of dehydration, which is particularly dangerous for kidney patients. This leads to electrolyte imbalances, potentially causing cramping or other muscle issues. Creatine supplementation in individuals with kidney disease presents several potential concerns. Interactions with medications commonly prescribed to kidney patients are a primary issue, as creatine may diminish the efficacy of certain blood pressure medications and potentially increase the risk of kidney damage when combined with nephrotoxic drugs. Gastrointestinal problems are another consideration, with some users experiencing nausea, diarrhea, and stomach cramps. These digestive issues can be particularly problematic for those with kidney disease, possibly leading to additional complications. The long-term effects of creatine use in kidney disease patients remain uncertain. While generally considered safe for healthy individuals, there are apprehensions about its prolonged use in this vulnerable population. Concerns include the possibility of accelerated decline in kidney function, increased risk of kidney stone formation in susceptible individuals, and unforeseen complications arising from altered metabolism in those with kidney disease. Given these potential risks, careful consideration and medical supervision are crucial when contemplating creatine supplementation for individuals with compromised renal function. It's worth noting that the creatine naturally present in food is usually not a concern for most kidney patients when consumed as part of a balanced diet. The problems arise with high-dose supplementation. If you're considering using creatine for any reason, it's crucial to discuss this with your nephrologist first. They can provide personalized advice based on your specific kidney function and overall health status. 3. High-dose vitamin C. Vitamin C, also known as ascorbic acid, is a vital nutrient known for its antioxidant properties and its role in immune function. While it's an essential part of a healthy diet, high-dose vitamin C supplements can be problematic for individuals with kidney disease. Let's explore this in more detail. The use of high-dose vitamin C supplements in individuals with kidney disease raises several concerns, primarily due to its potential to increase oxalate levels in the body. When excess vitamin C is consumed, it is excreted in urine, with some converting to oxalate during this process. This can lead to the formation of calcium oxalate kidney stones, a particularly dangerous risk for those with kidney disease who may already be prone to stone formation. Kidney stones pose significant risks, potentially blocking urine flow, causing infections, acute kidney injury, and necessitating invasive removal procedures. Furthermore, vitamin C's enhancement of iron absorption can be problematic for kidney disease patients receiving iron supplementation, potentially leading to iron overload and organ damage. For hemodialysis patients, high-dose vitamin C can interfere with glucose monitoring, risking improper insulin dosing. Paradoxically, while known as an antioxidant, high doses of vitamin C can act as a pro-oxidant, potentially increasing oxidative stress and accelerating disease progression. It may also increase blood acidity, challenging the already compromised pH balance regulation in kidney disease patients and potentially worsening metabolic acidosis. High-dose vitamin C can also interact with common kidney disease medications, potentially reducing the effectiveness of blood pressure medications and interfering with certain antibiotics. However, obtaining vitamin C from dietary sources like citrus fruits, bell peppers, strawberries, broccoli, and cauliflower is generally safe and beneficial, providing the vitamin along with other nutrients and fiber without the risks associated with high-dose supplements. The recommended dietary allowance for vitamin C is 90 mg per day for adult men and 75 mg for women, with smokers requiring an additional 35 mg daily. These guidelines help ensure adequate vitamin C intake while minimizing potential risks for individuals with kidney disease. Most people can meet these requirements through diet alone. Remember, more isn't always better when it comes to vitamins, especially for those with kidney disease. 4. Potassium supplements. Potassium is an important mineral for various bodily functions, particularly for heart and muscle function. However, for individuals with kidney disease, potassium supplements and even high potassium foods can pose significant risks. Let's delve deeper into why potassium can be problematic and what you need to know. Potassium regulates heartbeat, muscle function, nerve signal transmission, and blood pressure. It helps move important substances into cells and remove unwanted materials from them. In healthy individuals, the kidneys efficiently manage potassium levels by filtering excess from the blood and excreting it in urine. However, this regulatory process is compromised in those with kidney disease, potentially leading to a dangerous buildup of potassium in the blood. This accumulation can result in hyperkalemia, a condition with serious consequences, including muscle weakness, irregular heartbeat, and in severe cases, heart attack or cardiac arrest. Symptoms of hyperkalemia can be subtle or even absent until potassium reaches critically high levels, making regular monitoring essential for kidney disease patients. Given these risks, potassium supplements are generally not recommended for individuals with kidney disease. They can cause rapid and unpredictable increases in blood potassium levels and may interact with common kidney disease medications. It's crucial to be aware of hidden sources of potassium, such as salt substitutes, certain herbal supplements, and some over-the-counter medications. Dietary management becomes crucial, with many kidney disease patients needing to limit their intake of high potassium foods like bananas, potatoes, dried fruits, beans, and leafy greens. However, complete elimination of potassium is not advisable, as some is necessary for health. A renal dietitian can help create a balanced meal plan. Regular blood tests are vital for monitoring potassium levels, with treatments for high potassium including potassium binders, diuretics, and in severe cases, emergency dialysis. Understanding and managing potassium levels is a critical aspect of kidney disease care. Remember, managing potassium levels is an important part of kidney disease management. Always follow your healthcare team's advice regarding diet, medications, and supplements. 5. Excessive vitamin A. Vitamin A is a crucial nutrient that plays vital roles in vision, immune function, skin health, cell growth, and reproductive health. It exists in two main forms: preformed vitamin A, retinol, found in animal products, and provitamin A carotenoids found in plant-based foods. While the body can efficiently regulate vitamin A in healthy individuals, this process can be compromised in those with kidney disease. For individuals with impaired kidney function, vitamin A metabolism becomes a delicate balance. The kidneys normally assist in activating vitamin D, which works in tandem with vitamin A and helps remove excess vitamin A from the body. When these functions are compromised, the risk of vitamin A toxicity, hypervitaminosis A, increases significantly. Vitamin A toxicity can manifest with symptoms ranging from nausea and headaches to more severe issues like blurred vision, skin changes, and joint pain. Long-term excessive intake can lead to serious health complications, including osteoporosis, liver damage, and birth defects if occurring during pregnancy. These risks are particularly concerning for kidney disease patients who may already be vulnerable to bone problems and other health issues. Given these risks, vitamin A supplements are generally not recommended for people with kidney disease unless specifically prescribed by a healthcare provider. However, obtaining vitamin A from dietary sources is usually safe and important for overall health. Foods like sweet potatoes, carrots, spinach, and mangoes are good sources, while beta-carotene, a type of provitamin A, is considered particularly safe as the body converts it to vitamin A only as needed. Overall, managing vitamin A intake requires a careful, individualized approach for those with kidney disease, balancing the nutrients' essential functions with the potential risks of excess. Remember, while vitamin A is an essential nutrient, more is not always better, especially for those with kidney disease. 6. Mineral supplements: phosphorus, magnesium, and calcium. Mineral management in kidney disease is a complex and important aspect of treatment, requiring careful balance and monitoring. Phosphorus, magnesium, and calcium are particularly important minerals that can become problematic when kidney function is impaired. Phosphorus, essential for bone health and energy production, can accumulate to dangerous levels in kidney disease, potentially leading to bone weakening, blood vessel calcification, and other complications. Patients often need to limit high phosphorus foods and may require phosphate binders to control levels. Magnesium, vital for muscle and nerve function, can also build up to toxic levels in kidney disease patients. This can cause muscle weakness, breathing difficulties, and heart rhythm problems. Careful dietary management and regular monitoring are necessary to maintain safe magnesium levels. Calcium balance is intricately linked with kidney function, vitamin D metabolism, and overall bone health. Kidney disease can disrupt this balance, leading to either too high or too low calcium levels, both of which carry significant health risks. Calcium supplementation requires careful consideration due to potential risks of blood vessel calcification and medication interactions. For all these minerals, dietary management is key. Working with a renal dietitian is crucial to balance nutritional needs while avoiding excessive intake. Hidden sources of these minerals, particularly phosphorus in processed foods, need to be considered. Mineral supplements should never be started without professional guidance, as they can interact with medications and may have unintended consequences in the context of kidney disease. The approach to mineral management must be individualized, taking into account factors such as diet, medications, dialysis status, and overall health. Regular monitoring through blood tests is essential, as mineral imbalances can occur with subtle or no symptoms. As kidney function changes over time, mineral needs and management strategies may need to be adjusted. Remember, while minerals are essential for health, in kidney disease the balance becomes delicate. Too much or too little of certain minerals can have serious health consequences. 7. Protein powders. Protein management in kidney disease requires a delicate balance, as both excessive and insufficient intake can lead to health complications. While protein is essential for various bodily functions, including tissue repair and immune support, its metabolism produces waste products that damaged kidneys struggle to filter effectively. For individuals with kidney disease, high-protein supplements like protein powders can be particularly problematic. These supplements can increase the workload on already compromised kidneys, potentially accelerating kidney damage and causing symptoms such as nausea and weakness. Moreover, many protein powders contain high levels of phosphorus and potassium, which can be dangerous for kidney patients. Protein needs vary significantly depending on the stage of kidney disease and treatment. In early stages, a moderate protein diet may be recommended, while later stages or dialysis patients may actually require increased protein intake. This variability underscores the importance of working closely with a renal dietitian to determine individual protein needs. Instead of relying on protein powders, kidney disease patients are often advised to obtain protein from whole food sources such as lean meats, fish, eggs, and legumes, if potassium and phosphorus levels allow. These foods provide protein, along with other beneficial nutrients in a more balanced form. Regular monitoring through blood tests is important to assess how well the kidneys are handling protein waste. Parameters like blood urea nitrogen, BUN, and creatinine levels help guide protein intake adjustments. Special considerations must be made for patients with diabetic kidney disease, those on dialysis, and individuals following vegetarian or vegan diets. Exercise, while beneficial for kidney patients, can also affect protein requirements. Any new exercise regimen should be undertaken in consultation with healthcare providers to ensure appropriate adjustments to protein intake. In summary, managing protein intake in kidney disease is a complex task that requires individualized attention and regular monitoring. While high-protein supplements are generally discouraged, achieving the right balance of protein through whole food sources is crucial for maintaining overall health and preventing complications in kidney disease patients. Remember, while protein is essential for health, in kidney disease, the amount and source of protein become critical factors. Focus on getting the right amount of protein from whole food sources, as guided by your renal dietitian. This approach helps ensure you're meeting your nutritional needs while protecting your kidney function. 8. NSAIDs, non-steroidal anti-inflammatory drugs. NSAIDs, non-steroidal anti-inflammatory drugs, are common over-the-counter pain relievers and anti-inflammatory medications that pose significant risks for individuals with kidney disease. These drugs, which include ibuprofen, naproxen, and high-dose aspirin, work by inhibiting certain enzymes to reduce inflammation and pain. However, their mechanism of action can be particularly harmful to compromised kidneys. The primary concern with NSAIDs in kidney disease is their potential to reduce blood flow to the kidneys, potentially causing acute kidney injury or exacerbating existing kidney problems. They can also lead to fluid retention and increased blood pressure, and may interfere with the effectiveness of certain blood pressure medications commonly prescribed to kidney patients. The risks associated with NSAID use increase with higher doses, longer duration of use, and in individuals with existing kidney disease. Symptoms of NSAID-related kidney damage can include decreased urine output, swelling in extremities, shortness of breath, and confusion. Long-term use can potentially lead to chronic kidney disease or accelerate the progression of existing kidney issues. For individuals with kidney disease, safer alternatives to NSAIDs should be considered. Acetaminophen is often a better choice for pain relief, and non-drug pain management techniques like heat therapy, physical therapy, or acupuncture can be beneficial. In cases where NSAIDs are necessary, such as for severe pain or high fever, their use should be closely monitored and limited in duration. It is important for kidney disease patients to be aware of hidden sources of NSAIDs in over-the-counter medications and to carefully read all labels. Regular monitoring of kidney function is really important if NSAIDs must be used. By understanding the risks associated with NSAIDs and exploring safer alternatives, individuals with kidney disease can better manage their pain while protecting their kidney function. Remember, while NSAIDs can be effective for pain relief and reducing inflammation, they pose significant risks for individuals with kidney disease. Managing kidney disease requires careful attention to all aspects of health, including supplements and medications. The 8 items we've discussed, herbal supplements, creatine, high-dose vitamin C, potassium supplements, excessive vitamin A, certain mineral supplements, protein powders, and NSAIDs, all have the potential to cause harm in individuals with compromised kidney function. By staying informed and proactive about your health, you're taking an important step in managing your kidney disease. Continue to ask questions and stay curious. Your kidneys may be small, but they play a huge role in your overall health. Treat them with the care and attention they deserve. Thank you for watching. If you find this video helpful, don't forget to like, share, subscribe, and comment on your experience below. Keep safe and stay healthy.